What is a pollen allergy? Pollen is a yellow powder made by plants as part of their reproductive cycle. It floats in the air and can enter your mouth, nose, and eyes. Pollen is usually harmless, but for people with pollen allergies, it can trigger a stuffy nose, itchy eyes, headaches, and other symptoms. Different plants make different kinds of pollen. You might be allergic to pollen from trees, grass, or weeds. Each of these plants makes pollen at different times of the year, usually when the plant is blooming. This is when your pollen allergy symptoms are usually worst. Tree pollen causes allergies in the spring, grass pollen in the summer, and weed pollen in the fall. Some people call pollen allergies seasonal allergic rhinitis, or hay fever. Pollen allergy causes. When you have a pollen allergy, your immune system mistakes pollen for a dangerous invader, such as a germ. Because it thinks that germs are attacking the body, it tries to fight off the pollen. It releases chemicals meant to kill germs. These chemicals cause symptoms such as congestion, puffy eyes, and runny nose. These symptoms help flush germs out of the body, but when they're part of an allergic reaction, they're more harmful than helpful. You may be allergic to pollen from certain plants but not others. Some people are allergic to tree pollen, which is in the air in spring. Others have a problem with grass pollen, which is more of a summertime issue. Still others have trouble with weed pollen, which is common in the fall. Plants that give off the most pollen include trees such as oak, ash, elm, birch, maple, alder, and hazel, as well as hickory, pecan, and box and mountain cedar. Evergreen juniper, cedar, cypress, and sequoia trees are also likely to cause allergy symptoms. Grasses such as timothy, Kentucky bluegrass, Johnson, Bermuda, redtop, orchard grass, sweet vernal, perennial rye, salt grass, velvet, and fescue. Weeds including ragweed, sagebrush, redroot pigweed, lamb's quarters, goosefoot, tumbleweed, and English plantain. Types of pollen allergies. About 20 million Americans are allergic to pollen. Some people are allergic to tree pollen, which is in the air in spring. Others have a problem with grass pollen, which is more of a summertime issue. Still others have trouble with weed pollen, which is common in the fall. Plants that give off the most pollen include trees such as oak, ash, elm, birch, maple, alder, and hazel, as well as hickory, pecan, and box and mountain cedar. Evergreen juniper, cedar, cypress, and sequoia trees are also likely to cause allergy symptoms. Grasses such as timothy, Kentucky bluegrass, Johnson, Bermuda, orchard grass, sweet vernal, rye, and fescue. Weeds such as ragweed, sagebrush, mugwort, lamb's quarters, and tumbleweed. Pollen allergy symptoms. For most people, pollen causes problems when you breathe it in. But it can also cause symptoms when you touch it or get it into your eyes. Common symptoms of pollen allergies include itchy throat, red, itchy, watery, or puffy eyes, runny or stuffy nose, sneezing, wheezing or coughing, itchy throat or nose, sore throat, rash. Can pollen allergies cause sore throat? Yes. During an allergic reaction, your body makes extra mucus. This mucus is supposed to trap allergens so you can blow them out your nose. But some of that mucus doesn't come out your nose, instead, it drips down the back of your throat. This is called postnasal drip. It irritates your throat, causing inflammation and swelling. Pollen allergy diagnosis. If you think you might have a pollen allergy, see your doctor. They will probably ask about your health history and symptoms, such as whether your symptoms are worse at certain times of the year. There are two ways to test for a pollen allergy: a blood test and a skin prick test. A blood test checks for an antibody called IgE. This is a substance made by the immune system. It's specifically designed to cause an allergic reaction to pollen, so if you have it, you're probably allergic. In a skin prick test, a doctor called an allergist pricks your skin with a tiny needle containing a drop of pollen. After waiting a few minutes, the doctor will look at your skin for redness, swelling, itchiness, or other signs of an allergic reaction. Pollen allergy treatment. There are a few ways to treat pollen allergies and their symptoms. Nasal irrigation. This is when you rinse out your sinuses using a squeeze bottle, neti pot, or other device with a saltwater solution. It can help remove the allergen from your nasal passages and relieve stuffiness. Over-the-counter drugs. Antihistamines block histamine, the chemical your body makes when it comes in contact with an allergen such as pollen. Histamine causes allergic reactions, so blocking it will help relieve symptoms. Some common antihistamines include Zyrtec, Benadryl, and Claritin. Depending on the type, they could be a pill, liquid, or nasal spray. If your nose is stuffy, decongestants can help. They calm the swelling in your nose, helping you breathe easier. You can get them as a pill, liquid, or nasal spray. Some medications contain both an antihistamine and a decongestant. Decongestants can easily become addictive, so don't take them for longer than 5 days. Some other nasal sprays help with allergy symptoms, too. These might contain corticosteroids, which bring down the swelling in your nostrils. This should help get rid of the stuffy feeling and help you breathe. One option is Flonase, prescription medication. If the OTC drugs don't work, your doctor may prescribe something stronger. Some prescribed meds block chemicals other than histamine that can trigger allergies. Others treat the symptoms caused by certain kinds of weed or grass pollen. Allergy shots. If medications don't work for you, allergy shots may help. You'll go to the allergist every few weeks for the doctor to inject a tiny amount of pollen under your skin. Over time, the shots will contain more pollen, which will help your body get used to the trigger. How to prevent pollen allergies. The best way to prevent pollen allergies is to avoid pollen. Some ways to do this are: check the weather. Your local weather report should give you the day's pollen count, which measures how much pollen is in the air. It also usually tells you which plants are giving it off. Pollen counts are higher when it's warm, dry, and windy, and lower when it's cool, rainy, and wet. If you know it's going to be a high pollen day, stay inside as much as you can. The yard work can wait. Keep pollen out. Instead of opening the windows in your car or at home, run your air conditioner with a HEPA filter to remove pollen from the air. Don't hang your laundry on a line to dry or it may pick up pollen. Use the dryer instead. If you've spent time outside, change your clothing, shower, and wash your hair before you get into bed. If you don't, you'll transfer pollen to your pillow and blankets and breathe it in all night. If you let your pet spend time outside, don't allow it into your bedroom. Create a pollen buffer outside. Wear sunglasses to protect your eyes and a hat to keep pollen off your hair. Take medicine. When pollen counts are high, take your medication before you notice symptoms to stop them before they start. Pollen food allergy syndrome. If you have a pollen allergy, you may notice that your mouth gets itchy after eating certain fruits or vegetables. This is a common condition called oral allergy syndrome. It affects up to 3 in 4 people who have a birch pollen allergy. But it also can happen in people with other types of pollen allergies, such as grass and ragweed. Pollen is made of tiny proteins. Pollen proteins look a lot like the proteins found in some fruits and vegetables. Because of this, it's easy for your immune system to confuse the two. For example, it might think the proteins in an apple are actually pollen proteins. Your immune system mistakes these proteins for invaders such as germs, so it launches an allergic reaction. Usually, this allergic reaction causes your mouth, lips, tongue, or throat to get itchy and swollen. It tends to happen immediately after eating, but it could happen over an hour later. Although pollen allergies tend to peak at certain times of the year, oral allergy syndrome can happen in any season. However, the reaction might be worse in allergy season. Oral allergy syndrome is a type of mild food allergy. It's not usually dangerous, but in rare cases, it can cause difficulty breathing or anaphylactic shock. If you have trouble breathing or swallowing after eating a fruit or vegetable, call 911 right away. Pollen foods. The types of foods that trigger oral allergy syndrome depend on what kind of pollen you are allergic to. For example, if you are allergic to grass pollen, you might develop an itchy mouth after eating peaches. If you're allergic to birch pollen, foods that could trigger oral allergy syndrome include apples, apricots, cherries, peaches, pears, plums, kiwis, carrots, celery, parsley, peanuts, soybeans, almonds, hazelnuts. If you're allergic to grass pollen, Foods that could trigger oral allergy syndrome include peaches, watermelons, oranges, tomatoes, potatoes. If you're allergic to ragweed pollen, foods that could trigger oral allergy syndrome include cantaloupes, honeydew melons, watermelons, bananas, cucumbers, potatoes, zucchini. If you're allergic to mugwort pollen, foods that could trigger oral allergy syndrome include bell peppers, broccoli, cabbage, cauliflower, chard, garlic, onions, parsley, aniseed, coriander, caraway, fennel, black pepper. If you are allergic to pollen, you may not react to every food on this list. You might only get a reaction to one fruit or vegetable, or a specific variety of fruit or vegetable. Oral allergy syndrome only happens for raw foods. That's because cooking destroys the proteins that trigger the allergic reaction. If you have this condition, try sticking to cooked or canned versions of the foods that bother you. You also can try peeling fruits such as apples, because the proteins tend to be concentrated in the peels. Talk to a doctor if your symptoms are severe, especially throat discomfort. Your symptoms are getting worse. You get symptoms after eating nuts. You get symptoms after eating cooked foods. Your symptoms affect your whole body, such as vomiting or hives. Takeaways. When you have a pollen allergy, your immune system mistakes pollen for an invading germ. This leads to symptoms like a stuffy or runny nose, congestion, and puffy eyes. If you think you have a pollen allergy, talk to your doctor about remedies such as over-the-counter and prescription medications. Pollen allergy FAQs. How can you reduce pollen allergies? Staying indoors when there's a lot of pollen in the air and taking over-the-counter or prescription medicines can help with pollen allergies. What is the best medicine for pollen allergies? In general, antihistamines are good for treating itchy eyes and sneezing, while decongestants and nasal corticosteroids can help with congestion. Each medication has different risks and side effects, so ask your doctor about which is right for you. Can pollen allergies cause fever? Allergies themselves don't cause fevers. But the swelling and congestion caused by allergies can make you vulnerable to sinus infections, which can cause fevers.